morning, everybody. How's the audio working for folks? Yay, looks like it's working out just fine. We are going to record today's call just because I know that it was kind of short notice and there's some of us that aren't able to join because they had some other commitments going on, which is perfectly fine. There will also be the slide presentation saved and uploaded and shared with everybody. There's a second document with some examples that is a Word document that you guys might find helpful as well. And so we'll be sending that out immediately after the call as well, so that you guys have that in your hands. One of the suggestions I wanted to make to you guys as we get things started, there may be some questions that you guys have. Please feel free to put those questions in the question box and we will get to answering those as quickly as we can. I think I set up the call just for an hour, but I am going to plan to remain on the call and answer as many questions as possible. The other thing that we are doing with our questions and answers is we are posting those in the Teams meeting thread that is titled State of Emergency. And so you will find all the questions and answers posted in there as well. So one of the suggestions I have for you is if you've got a particularly long question that you're typing out, if you feel like we're going to shut the session off before you get your question completely answered or typed in or whatever, maybe you want to write your question in like a Word document or something and then copy and paste it into the question box. Or it's okay to also kind of do half a question and like put some dots at the end to let us know that there's more that you're trying to still put in, but you just need a little bit of extra time to fill that information in. Okay, so it is a couple minutes after 10, so we're going to go ahead and get started. So one of the first things I just want to tell people is you just need to relax. We get it. There's a lot going on. There's a lot of information that's being shared your direction and flooded your inboxes, and sometimes a lot of the emails contain quite a lot of information, and it's sometimes tricky to get through all the emails before another one comes in with different information about what you're supposed to do or how you're supposed to handle things. And so just realize that in this time of a lot of massive information being flooded at you, we get it. Everybody is stressed. Everybody is uncertain about what the next step is supposed to be in terms of what they're supposed to do for their job, or providers are telling them to do one thing and supervisors are telling them to do something else. And then there's an email from me saying, oh no, we got to do this now. So we get it. There's a lot of confusion. So please just understand nobody's job is in jeopardy. We know that you guys are doing the absolute best that you can with the limited amount of availability that some of you have in terms of everybody is on the stay-at-home order. And so we get it. There's more people in your house. And so other forces are drawing against your energy and your time and your availability and those kinds of things. So please just relax and know that nobody's getting fired because a case note's 10 days late or 5 days late or whatever. So we're going to talk about some of that stuff a little bit later, but I just want to reassure you, nothing is in jeopardy in terms of your employment. Currently, both Advocacy Links and DDRS, the primary concern really is everyone's health and safety, not only for the individuals we support, but for all of our staff as well. And I'm not just talking about, are you having breathing problems? I'm talking about your mental health as well. I get it. There's a lot of anxiety, and regardless of what your personal feelings are about the validity of this pandemic, it doesn't really matter. There's still anxiety going on out there, and we each need to recognize that we're all handling it differently, and we need to respect that. I mentioned earlier that I understand there's a flood of information that's headed your way. You've been getting it. It's very hard to keep up. I get that. So today's call really is an effort to try to consolidate everything that has hit your system in the last several days to kind of give you a point in time reference of, as of this second, here is what case managers are being instructed to do in terms of the directives from the state. There's a lot of information that I basically just stopped sending you guys, mostly because a lot of the emails that are coming from the state contain gobs of information that pertain to things other than just case management. So for example, yesterday afternoon, shortly before 5 o'clock, BEADS released a bulletin that was 13 pages long that contained information about group homes and day service providers, how they should plan for billing for things, and all sorts of information that has absolutely nothing to do with what the role of the case manager is. And so I'm sure those of you who are signed up for the DDRS bulletins, you got that, and you probably looked at it and went, holy cow, how am I supposed to digest all of this? Please understand, I'm not expecting you to. Again, that's part of what this presentation is geared to do, is kind of filter through that flood of information to really just simplify the information that's critical for you to do your day-to-day jobs. There will be some things that I mentioned about some of those other things that were in that bulletin, but it's more for just a general overview so you understand kind of what's going on in other service provider areas. It's not that you need to do anything related to those. So you hopefully have already seen some of the tools that have been in place. I already mentioned that thread on the Teams app that is entitled the State of Emergency. We have been, to this point, starting to include questions and answers that have been coming in email form. I wanted to create a one-stop shop for people to be able to go to find answers without having to wait for whoever they're asking to, get to their email that came through 2 days ago or whatever. Everyone is being flooded. And so I'm trying to keep that updated every single day with, if an answer changes because there's new information, I'm trying to update the replies in the answer areas for each of the questions. As you guys are using that, please reference it. Don't feel like you have to keep asking your supervisor, what do I do in this situation? Please start with that Teams app because that really is as up to the minute current as I can possibly keep it. I am updating it every single day, but perhaps you don't realize that I'm truly getting emails pretty much every single hour from somebody or another with something new that's coming down the pike. And so I am trying to go in there and keep that updated. The other thread that is on the Teams app that you might find helpful is the thread titled Coworkers. It's not really a question and answer section. This is more a kind of a stability check-in kind of thing. A lot of the information that's being shared there is humorous information to kind of get us through this highly anxious time. People are sharing comments about what their new coworkers are doing, and I have coworkers in parentheses, or quotations, I guess, not parentheses, because as you're all aware, we're in our houses with our spouses and our children and our animals and those kinds of things. And so a lot of the information that's on there is just kind of humorous scenarios that have occurred while we're trying to get our jobs done amidst all these new coworkers that we have. So take a look at that. If you feel comfortable sharing something that's going on in your life, please feel free to add to that thread. It's really important that we are providing consistent communication, both with our supervisors as well as the teams that we're working with. So on the screen, I have provided some contact information for Heather Van Ness. Any of the human resource related kinds of questions that you have, I would really request that you guys submit those by email or leave an email or a text message for Heather to let her know what the questions are that you have. Maybe they're related to paid leave or FMLA or anything really. It's really essential that all of those questions just go directly to Heather. We don't need to bog down supervisors with those kinds of questions. They're being flooded with so many other kinds of questions. It's certainly okay for you to send Heather an email and CC your supervisor. Please don't think I'm trying to exclude your supervisor. What I'm trying to do is streamline the amount of questions that supervisors are getting because they're getting flooded. So please just kind of bear that in mind. Any of those HR kinds of specific things need to go directly to Heather. We're going to talk about this, and you're going to hear me repeat this multiple times today in terms of how key documentation really is at this point in time. As you guys are aware, we're doing everything virtually. We're operating under the stay-at-home order. There really should be no reason for people to be leaving their house. I get it that people need to go buy some more milk or whatever. I get that those kinds of things that were outlined in the state of emergency, stay-at-home order, there's certain examples where you are leaving your house. But for the most part, for your job-related activities, there's really nothing you're doing outside of your house. Most of your activities are being done either over email, over phone calls, maybe a conference call, those sorts of things. And so as we are doing those kinds of things, it is so important that we are documenting consistently. Things are changing so rapidly, and the state is relaxing quite a lot of rules in terms of how documentation needs to be in place in terms of transitions and those sorts of things, that it's critical that we are keeping our case notes up to the minute current. And I say up to the minute, but I also recognize that's not realistic. I get it that, maybe you're completing quite a few phone calls in a day and you've jotted down several notes as you've been making those. Please make every effort possible to at least get those case notes entered within a couple of days of when your phone call happened. At the very minimum, please make sure you're adhering to the existing rule about completing case notes within 7 days of the activity. DDRS really is reading through our case notes to get a feel for what's going on in people's lives. It's the only way that they are figuring out if people are needing to be relocated, if somebody's been diagnosed with the virus, those sorts of things. And so I cannot explain enough about how important it is for you guys to be documenting case notes. We're going to talk a little bit more about that and share examples with you as we go through today's conversation. Again, as a reminder, if you yourself are sick and you are not able to complete your job because you're on bed rest or whatever it is so critical that you are talking with your supervisor and with Heather about those kinds of support needs that you have, because we have other staff that can step in and help, as we always have when people have been sick or have been hospitalized or having a baby or whatever they've got going on. We've been very good about making sure that other people are stepping in to help with those kinds of support needs, but it's essential that you guys are communicating those needs to us. If we don't know that you're struggling and can't breathe anymore or whatever, if we don't know that, then we can't help. So please just make sure you're taking care of yourself and asking for the help that you need. One of the other things I want to say about the information on this slide is please don't be afraid to send reminders to people, specifically in emails or whatever. everyone is getting flooded with information right now. And so if you have sent a request to somebody, you know, to me even, that says, hey, Joy, you know, when's the company picnic or whatever, if I'm streaming through my emails, I'm triaging, honestly. I can guarantee there are emails in my system, in my inbox right now that came in a week ago that I haven't done anything with because there's too many other more important kinds of things that have come through that I need to address immediately. And so it's not that I don't want to answer your question about when the picnic is or whatever it is you've asked. I'm just needing to look up the date on the calendar, and at that precise moment that I see your email, I don't have the time to do that. And so sometimes those emails get pushed down a little bit in my inbox, and it takes me a few days to get to them. And so I'm using me as an example, but I feel like there are some other individuals that are developing attitudes about, well, I just can't send emails to this person because they never respond. And so please stop copying attitudes about people not responding to emails or answering phone calls. This is a really critical time, and I get it that there may be some historical examples of things not getting answered quickly or whatever. Let's please just be respectful of one another. And if you haven't heard a response from whatever question it is that you've asked, please don't be afraid to forward that email again to the same person to say, hey, maybe I didn't get the response, or maybe this got lost. I do still have this question. You know, I'm looking for an answer, you know, in the next 7 days or whatever. Please send those reminders. We can't necessarily know that we've forgotten something. We're all human. And so we just need to be reminded sometimes on some of the things that we might have got lost in the shuffle. Okay, so on the screen here, you see kind of the bullet points that BEADS has listed out as the current expectations for case managers in this current health situation that we have. You can see over on the left-hand side that they've kind of bullet pointed that our main priorities are really just being the frontline communication in terms of coordinating whatever support needs that people have. We need to be acting as problem solvers, advocating for the people that we support, but also supporting the team as a whole, and maybe helping prioritize situations that come about. Our primary concern is more, as I said earlier, looking at, are the individuals that we're supporting remaining safe and healthy? We get it that we've got these beautiful PCISPs that are really gearing up for, hey, this is what a preferred good life looks like for this person. That's fine and dandy in the normal world, but this that we have now is not the normal world. So while an individual may prefer to do a one-on-one activity in the community, going to the craft store and picking out crafts and attending the craft class at the craft store, that might be the perfect ideal world kind of thing for them to do. But in today's time, that's not going to be something that is going to happen because of the stay-at-home order, because of so many different things going on, staffing shortages and those sorts of things. And so we as case managers need to not be so focused on, but they've got a goal for going to this craft class. Our primary concern right now really is just making sure people are healthy and safe and doing activities that are preferred for them, but maybe not necessarily as it's specifically outlined in the PCISP. So we just need to be a little bit more flexible and not so hard-nosed, I guess, in terms of the letter of the law of what's written in the PCISP. I already mentioned about the necessity of having consistent and timely case notes. I, again, can't stress enough about how important that really is. This is really not the time to be thinking, okay, it's the first of the month, let me go ahead and enter a case note. Okay, I'm done for the month. That is absolutely not the mentality that we need to be having. We really need to be looking at the situation in terms of, if this person that we are supporting was actually our sister or brother or mother or father, would we only be talking to them once every 90 days or once every 30 days or whatever? No, in today's world, we're checking in on our relatives and our loved ones much more frequently. And I'm not saying you need to have daily contact with every single one of your people. You guys know who the people are and what their natural supports are or their paid supports. You know who really needs to maybe have a weekly contact or maybe an every other week phone call or whatever that looks like. I'm not going to dictate what that looks like, but I am going to stress that once a month is not probably the right answer. A lot of the things that we're going to work through today are a lot of changes that DDRS has okayed in terms of relaxing a lot of deadlines and processes that in our normal world, we have to follow those kinds of things. But in our current situation, it's kind of weird. We're doing what we can to prevent bottlenecks and backlogs in the system and to keep everybody sane in the process. So what we're describing may not really be the ideal situation or a best practice standard, but it's what the state is comfortable with in terms of relaxing regulations and those sorts of things. So again, to reiterate some of what we're doing with the teams, we need to be helping adjust expectations in terms of, yes, the PCISP says they're going to go to the craft class every Tuesday, but we understand that's probably not going to happen. So we just realized, you know, we're not going to be writing incident reports because they didn't go to craft class. We need to be educating families also on just adjusting their own expectations and also adapting to the evolving environment. Some of the things we're going to talk about today is related to the potential that people might need to move out of the house that they're currently living in for a couple of days. So there's some of that we're going to talk through. We still need to do the best that we can to apply person-centered approaches and responses to the events that are occurring. Like I mentioned earlier about the craft class, yes, somebody may really enjoy going to the craft class at Joanne Fabrics, but maybe in this time, maybe that person could go get the curbside delivery service from Joanne's Fabrics, and instead of attending the craft class, maybe they're picking up items from the store to bring home and participate in an activity. One of the things that Joanne's is doing right now, if you haven't seen it on Facebook, is they're encouraging their customers to sew the face masks that are desperately needed by healthcare workers and those kinds of things. Now, maybe our individuals don't have sewing machines, so maybe that's not a logical thing for them to do, but they, like many other stores, have the ability to call ahead and say, hey, I'd like to pick up a skein of yarn or some knitting needles. I'd like to learn how to knit this week or whatever. So we need to be creative in terms of if somebody's got a preference for an activity or whatever those kinds of things are, what are some things, some modifications we can make in our current environment to be able to still bring about the ability for them to engage in those types of activities. Okay, so let's talk about the stay-at-home order for just a little bit. Currently, and this could change, that's why I say currently, the stay-at-home order that's in place in the state of Indiana does not have a travel ban per se in terms of if you're happening to be driving somewhere, most likely a police officer is not going to be pulling you over and questioning you about where you going, who you seeing, you know, why aren't you at home? We are encouraged to stay at home, except for going out to get supplies or checking on our elderly loved ones and those sorts of things. As I already mentioned, our job has really significantly changed for the time being in terms of the requirements for what we're doing. And pretty much 99% of everything that we are currently doing can be done from our homes. The really only situation where you might actually have to leave the comfort of your home to do something would be in the dire situations where there might be an incident report where abuse, neglect, or exploitation is alleged. If you're getting those sentinel event notifications saying, hey, you need to ensure this person's health and safety. Those are situations that you have to have that physical, personal contact with your individual to make sure nobody's beating them up or threatening them with a gun or whatever it is that's being alleged. That is a situation where you would need to go, somebody would need to go and have that physical contact. We as a company are not providing broad letters to every employee to classify them as essential health workers, because the need truly isn't there. However, if there is a situation where you've received this sentinel event saying, hey, please go make sure this person is actually safe, that is a situation where you need to reach out to Heather. If you yourself are going to be the one that goes to do that physical in-person health wellness check, basically. If you have received that sentinel event notice and you are in a position where you are not able to physically go, then you need to be reaching out to your supervisor to see who else within our company can make that personal in-person visit to make sure that person is safe. Back on that topic, Heather sent me a note real quick that said, if there's an immediate need like that sentinel event kind of thing, it's best to reach her most expeditiously by either calling or texting her. All right, so here are some of the adjustments to the case management responsibilities. Some of these are ones you're already aware of, and I'm expounding a little bit on them to kind of hopefully provide some clarification, and some of them are new as of the bulletin from yesterday. So the home visits and the team meetings, as you're aware, you're already doing those by phone or conference call. Some of you have Zoom accounts set up or other sorts of conference calling kinds of apps or those kinds of things. Those are perfectly fine. We just need to make sure that we're doing those in a private location instead of out in the middle of our living room with all of our children running around listening to the conversation and so forth. Earlier there was some confusion about the face-to-face component of visits and team meetings and those sorts of things, and I hopefully have already clarified this well in terms of that face-to-face component really is supposed to be between the case manager and the individual that you're supporting. It doesn't have to be everybody on the team having a face on the screen or something like that. So what a lot of people are doing is they're using like the FaceTime or the camera app on their phone to have that face-to-face virtual contact with the individual, and then they're setting up the rest of the team members to join in on the call or whatever, those kinds of things. We just need to be clear in our case notes about how that looks. So there's some examples that we can share with you of some ideas about how you might word those. The virtual home visits and team meetings does not apply to the unannounced visit. We're going to talk a little bit more about that in a little bit. As I mentioned, there's some clear direction from the state about the documentation requirements to support these virtual team meetings. And again, I've got another slide devoted directly to that. So incident reports. For the time being, BEADS has lifted the 24-hour from the activity or the event submission timeframe for most of the things that we're submitting incident reports for, like med errors or somebody fell and broke their ankle and they went to the hospital and they got a cast. Those sorts of things need to be reported within 48 hours of the occurrence or the knowledge of the occurrence. Anything related to suspected abuse, neglect, exploitation, or the presumed positive of COVID, or the tested positive of COVID, those items would be ones that you would need to still submit within the 24 hours of when you become aware of that. Providers have been informed not to submit incident reports for the closures of their, the temporary closures, I should say, of their service locations. So a lot of day service providers are starting to send out the notices now saying, hey, effective Tuesday, we're no longer going to have individuals come into the day service location. What BEADS has asked is that those providers just send those emails to the case managers and to BEADS, of course, but they are not going to be sending out 2,400 incident reports for the 2,400 consumers that are coming into their day services sites. So just be aware that is a change. Previously, when a service provider did shut down location, if there was a fire or something, they did have to submit incident reports for every single person that was impacted. So just be aware you're not going to get incident reports, but those are things that you have to document in your case notes about, hey, got the notice from Logan that as of this date, they're no longer going to be offering day services at their Jefferson Street location. The incident report follow-ups will still continue to need to be submitted with the existing timeframes, this follow-up every 7 days and so forth. Again, here's a comment about the critical nature of communicating and collaborating with your teams. Now is not the time to be butting heads with providers. We really all need to be kind of figuring out how to make things work in this really unique situation that we find ourselves. A lot of providers have, agency plans set up in terms of, if they need to partner different departments together and share the staff between them and those sorts of things. We as case managers need to be cautious about challenging those. Certainly we want to advocate if there's, an individual that you're supporting that is going to not do well because they have this highly negative relationship with a person that they're going to have to spend the next 3 days with. It's okay to express concerns, but maybe there's some suggestions that you guys can come up with as a team to kind of help smooth through that potential negative situation. So I'm just encouraging you to please be speaking with your teams consistently, documenting in your case notes what those plans are and those sorts of things. But now is, like I said, really not the time to try to butt heads with provider and question everything that they're doing or not doing or those sorts of things. Deadlines from the state in terms of a lot of our work assignments are being relaxed quite a bit. As I mentioned earlier, there's some things that were outlined in the bulletin yesterday that I'm not even going to take the time to kind of go through certain numbers of days or those kinds of things because it really doesn't matter. What our hope is that all of our staff will continue to operate the best they can with our current timeframes so that we are preventing future backlog. If we, decide, okay, well, they've given me, 7 more days to do levels of care or whatever, okay, well, that's just adding to your plate. And if something comes up between now and then, you're going to be behind the 8 ball and you're just setting yourself up to dig yourself a huge hole for work that needs to be done later. So we get it that, maybe something comes up and you can't get something done within a specific time frame. All we're asking is that you do the best that you can, document what you're doing and communicate with your supervisor about, hey, I'm struggling with this, it's going to be, a day late or whatever. Those are just things that are going to happen in this time, and we all recognize that. It's, again, not an ideal situation, but we're doing the best that we can. Everybody is. Okay, so here's the reminder about what the expectations are for the phone meetings. These are the documentation standards. This is something that I already shared with you guys already in terms of how you need to be recording in your case notes when you have the team meetings that are held over the phone and so forth. The state was very clear about which boxes we were supposed to be checking. for our case notes for those types of activities. I'm not going to read everything on the screen because it's information you've already got. So on this screen, this is some suggestions about when you're making those phone calls to check in on your individuals to kind of make sure everybody's healthy and safe. These are some ideas of things for you to consider using as conversation starters. The items at the top of the page are things that are really critical information you actually need to document in your case notes. And the items at the bottom of the page are things that through the course of your conversation, you might want to try to inflect some sort of positive conversation topics. Please don't make it be so draining. The only reason I'm calling is to make sure you're still healthy. Okay, talk to you next week or whatever. That's not the intent of these types of phone calls. Please make sure you're kind of giving the individuals or their family member, whoever you're speaking with, the opportunity to vent a little bit in terms of what's going well or what's challenging right now, or those, what's going really well. What have we learned new about this person because of this situation? So just use these as a tool. This is one of the things I'll be sending out after the call as well to those that want to, kind of use this as a guide as you're having the conversations. Feel free to do that. Also use it as a guide as you're writing your case note from your calls. The items at the top are things that the state would like to be able to see evidence of in the actual case note that you're writing. And again, one of the things that I'm sending out is a sample of a series of case notes for a couple of people that reflects this information. All right, so let's talk about unannounced visits. The entire intent that the state has with unannounced visits has always been, it's an opportunity for the case manager to physically in person see a point in time in an unplanned time frame that what's going on in somebody's site. Is their caregiver, sleeping on the job, or is their, house not stocked with enough food, or those sorts of things. It's designed and intended to be an actual live in-person on-site type of contact. So these kinds of activities for the unannounced visits are not ones that can be completed over the phone. These are ones that have to be done in person. If you have a visit that is due here in March or coming up in April, chances are really good you're going to need to postpone that. And that's completely fine. We get it. It's going to show up on a report that you're late or whatever. That's fine. We recognize that. We still want you to go ahead and call the individual like we had described earlier in terms of checking in and making sure they're healthy and safe. But you need to record in your case notes that was a phone call. Do not mark that as an unannounced visit. We would like for you to still plan to have the unannounced visit, but you're going to need to do it later. And we don't know what later means. We get that. But at the same time, because the nature of that type of contact is to be done in person, we want it to actually be done in person when we have the ability to do that. And we recognize that might be a month, 2 months, who knows how long it's going to be. We're all of us, me looking at hot lists or those kinds of things, we recognize you haven't been able to do it. We do want to see in your case notes that you also recognize you can't do it, but you're planning to do it in whatever, May or June or whenever this health situation gets resolved to the point where we can actually have physical contact with others. The thing I will say about the unannounced visits is just a reminder. We've always tried to educate people about this, but I think sometimes we get busy and forget. These unannounced visits do not have to be done exactly 365 days from the last one. You can do unannounced visits anytime throughout the entire year that you want. You don't have to limit them to one. You can do 7 a year if you want. Every time you do an unannounced visit, the clock resets and you have another 365 days from that visit to do the next one. So just bear that in mind as we're moving forward and you're planning activities when we kind of get back to whatever the new normal is. All right, budget modification requests. I sent out a note a couple of days ago just checking in to see if our staff have been getting flooded with these. Some case managers at other case management companies have been inundated by providers saying, oh my gosh, we've got this situation. We need, 42 different beamers for these 42 clients. We don't really have all the information yet, but we just wanted to get the request in now because we only have 45 days. And so the state has extended basically the time frame of when beamers need to be submitted. So currently, in our current situation, the state is asking that beamers can be submitted up to 60 days. From the event, which is actually the second following along. And then
whatever you want, honey. It's fine. Just gonna lose your meat is all I wanted to do, but I can help with the break. Too, really for sure. Load. Yeah, it's fine.
Okay, hang on one second. We've got somebody not muted. Okay, now they've remuted themselves. All right, so on the first bullet point in this, it's referring to beamers beyond the first one. As you're aware, the first one can only be submitted for 90 days, and that was it. Now the state is saying that if you've already submitted your 90-day beamer, you can continue submit beamer request for a period of 60 days until further notice. So there may be 3 more beamers that we're asking for, each for 60-day periods beyond that original one. So who knows how long this situation is going to last, and so that's why they've said until further notice. So again, the one time only for 90 days is now. Do the 90-day for the first one and then submit beamers thereafter for 60-day periods of time. Okay, so I had mentioned I'm going to share a little bit of information about some of the relaxed criteria for provider agencies that the state has issued. This information on this slide is more just an overview, general information for you. You don't need to do anything about this, but you need to be knowledgeable about there's some available things that are in place that were not previously in place that might be helpful as you're talking with families and they're sharing their concerns about things that historically have been a problem. So for example, the state has increased the flexibility for family caregivers. As you're aware, in the past, the 40-hour-a-week total for related caregivers related to the individual served was limited. It was 40 hours max. Currently, the state has thrown that out the window and said, it doesn't matter. If grandma wants to do 40 hours and Aunt Susie needs to do 20 and whatever, then that's fine. We just need to make sure people are safe. Another thing that has been lifted is currently minors cannot get services through PAC, Community Hub, or RHS that's provided by their parent, their step-parent, or their guardian. Again, that has been thrown out the window. In the current state, we are able to allow parents to be the paid caregivers for those 3 services. Previously, spouses could not be the caregiver in a supported family setting. And so again, that rule has been temporarily lifted. So now spouses can be paid caregivers in the supported family caregiver settings. There's quite a lot of information in the BEADS bulletin related to relaxing requirements along the hiring and training process for new staff that are providing RHS and those types of services. I'm not going to bore you with those details because it honestly means nothing to the role of the case manager. There are some alternate living settings that are being approved by BDDs that providers can start to think through as option as they're trying to figure out what to do with all these people that they're supporting. How do we provide enough staff and those sorts of things? So again, I'm not going to bore you with those information pieces from that bulletin. Like I said earlier, if a provider comes to you and says, here's what our plan is, it may not make any sense to you at all why, you know, somebody needs to move across town or whatever, but hopefully they have already thought through, okay, well, he doesn't get along with the guy that lives down the hall with him, so it doesn't make sense to just have those two apartments together. We need him to go across town, you know, because he gets along better with that guy or whatever. We all need to be trusting that providers are really trying to think through the best case scenarios during these times of emergency. The bulletin also outlined some alternate service locations. So one of the questions providers were asking was, could we provide day services out of a group home? Or could we provide, you know, job employment services out of the person's home instead of at the actual job site, or those kinds of things. So again, that bulletin laid out some clear expectations for providers to consider related to those areas. And again, I don't need you to understand and be proficient in what was in the bulletin. What I need you to do is trust the providers. If they give you a plan saying, here's what we're thinking is going to work, we just need to be accepting, I guess, within reason. I'm not saying set your people up to fail or have a bad few days. If there's something that's really concerning to you, don't be afraid to advocate on behalf of your person to maybe reconsider or maybe offer some alternate suggestions to make that transition a little bit more smooth. But now is not the time to throw up walls and tell providers that they don't know what they're talking about. One of the other things that BDDs has temporarily lifted is the rule about having overnight sleep staff. Previously, that was not something that could be allowed, but currently, if you look through the words on the bullet underneath this, there's some documentation that's required. The team needs to agree that it's okay for a sleep staff person to be in place, and that needs to be clearly documented by the case manager. So if this is an option that your team is choosing for the individual that you're supporting, please make sure that you are documenting that in your case notes to reflect that the team agrees and so forth. As I mentioned earlier, now's not the time to be arguing with providers. We just need to reflect in our case notes what the plan is. The burden of proof for provider agencies for billing is going to fall on them. Nothing in your documentation is going to either allow payment or not allow payment for them. If they're billing for a service, they need to, on their end and their documentation, reflect why they've chosen to deliver day services out of the group home or whatever it is that they're doing, which logically doesn't make sense. They need to have that documentation for auditors that come and look at their records. That's not necessarily something that you need to worry too much about. You just need to document in your case notes what the plan is that's been relayed to you. As I mentioned earlier, we really do need to be advocating for our people. If you are concerned about the plan that has been presented, don't just go with it. If there's something legitimate that you feel like, have you guys thought about this? It may not be something they talked about, but please just be respectful in your approach to, I guess, advocating. I mean, again, we don't want to be butting heads. Everybody is on high anxiety right now, and we need to be super cautious as much as possible in terms of, okay, I get it that this might make sense, but is there something we can do to, you know, maybe give him a break from this guy that's tormenting him all the time? So if you have some suggestions for those kinds of things, please just share those with the team respectfully. So there's a few things that we're still waiting for some additional guidance on. Emergency transitions is one of them. I know that some case managers were getting a lot of requests, I guess, from provider agencies related to, hey, we might need to move this guy across the hall or down the street or whatever. And those were situations in the past where we had to do those temporary relocation, emergency transition kinds of things that then kind of turned into full-blown transitions and those sorts of things. So currently, what we are doing is if there is somebody that is just moving across the hall or down the street or whatever it is, because of this current health situation, the expectation of BEADS is that we're recording that information in our notes with detailed information, but the emergency transition form and changing the address and all those kinds of things should not be happening. And we'll go a little bit more into some conversation about my comment about the home of the DSP in just a little bit. CCB updates, currently we're continuing to process those as we typically would. If there's significant changes that need to be updated related to the CCB, then we do need to do those. PCISPs, if there's some sort of permanent change that's going on, you know, maybe they've changed their doctor or maybe they've, you know, stopped all of their work at Taco Bell or whatever it is. If there's big permanent changes like that that need to be updated, you need to be making those changes. But in terms of, you know, they wanted to go to the craft class and that's not happening right now because of the stay-at-home order and those sorts of things, don't feel like you need to update your entire PCISP because for the next month or two, they're not going to be able to go to craft class. Those are not significant changes that you need to feel like you need to update all the PCISPs because things are different for the next little bit. Beamers and BRQs, we talked a little bit about that on the previous slide. So we are continuing to process them, but there's some modified timeframes for the Beamers that didn't exist before. All the changes that the state is making are being retroactive to March 1st, and that doesn't mean anything to you. You don't need to predate anything at the moment. That's more kind of a date for providers to understand in terms of how they're setting up their billing situation for the services that they're providing and so forth. So the bullet point from the bulletin, I just copied and pasted here. It's the bigger piece that you need to pay attention to is that these are all temporary changes. Nothing that's in this guidance for today's environment of doing our job. These changes are not things that you should plan for to be in place forever. We don't know how long they're in place for, but the intent is not that this is the new way of doing case management. So just be mindful of that. Okay, so residential services. I mentioned earlier that there are some providers that are kind of thinking through what's going to be the worst case scenario, what kinds of plans do they need to have in place in terms of how they're going to make sure that people are safe. Again, some of the things that they're putting together may not at all be preferred. It's not maybe the best option that somebody wants to have, but because the greater priority is somebody getting oversight? Are they still safe? Are they still healthy? Those are the greater concerns at this point. So we just need to be as supportive as possible in terms of respecting whatever plan it is that residential providers are coming up with. There are some situations where some providers are starting to think through, okay, if we've got 200 people to serve and we have 20 staff people, how are we going to realistically serve these people with this few number of staff people? It's been a little bit scary on some of the calls that I've been on, because I literally heard provider agencies talking about clearing out their day service buildings and bringing in cots to have people stay on cots, mass groups of people stay on cots in the day service building because they can house whatever, 200 people in one room or whatever in this time of emergency. That's scary to me. But I also recognize this is not the world we lived in a year ago. And so while we don't really want that to happen, the reality is it might actually, and not that it's going to be the new norm that we're going to have these housed people of 200 people in a room for the next 6 years. That's not the intent. It's really just to get us through this time of crisis. You've probably started to see visitor restrictions implemented. Again, now is not the time to challenge providers. They need to be protecting the wellness of their workers as well as the people they're supporting. And so we're on the stay-at-home order and anyway, so in terms of, not having visitors come to people's homes or wherever they happen to be, now is not the time for us to be challenging that. We also need to support the providers in terms of educating families about, okay, this is not the preferred way of living for your loved one, but because of the health emergency that we're in, we really do need to take some extra precautions. The provider's not trying to prevent you from seeing your loved one. What are some other options that we can implement? Could you maybe drive by their house and you guys can meet on the park bench out front and have a conversation or whatever? We've got to be creative to kind of ease people's minds about their loved ones being safe, but at the same time respecting the social distancing and the concern for the spreading of the disease. So let's continue to talk about the potential of changing service locations for residential services. One of the options that was discussed was making sure that the case manager is informed and is keeping clear documentation in their case notes about if somebody is no longer living in the address that is reflected on the front of the portal, if they have temporarily moved across the hall to apartment 2B instead of 2C, that just needs to be recorded in the case notes. There doesn't need to be an incident report submitted about that. There doesn't need to be a transition plan. They're just going to be there for a few days, maybe a week or whatever, hopefully. Again, we don't really know, but in your case notes, you need to be mentioning what the change in the situation, the living situation is, why the change was needed, and when the anticipated time frame is that they'll be at this living arrangement. And again, there's some case notes, some sample case notes that I'll be sharing immediately after this call for you to kind of read through to see how this is laid out in there. If the move that is occurring now actually does happen to be a permanent change, maybe somebody was already in the process of getting a new housemaid and changing their apartment or whatever, if there was already a transition in process and this move to this new place is a permanent change, then we still need to update the living arrangement as we would have before these guidelines were changed. The transition would be handled in the same way that it used to be. Okay, so this slide is an absolute last resort, but the state wanted to put it out there as an option for providers to consider if there was absolutely nothing else available. This would be if caregivers needed to provide services to an individual out of the DSP's home. So if there is an individual that has been working with staff person Joe for the last 15 years and they know each other well, and every now and then the individual goes home and spends Christmas with Joe or whatever, they've got this connection. If there's something like that that is in place already, and whoever the staffing pattern is that is supposed to be providing care to the individual has now been diagnosed with the virus or been quarantined or whatever, then the state is allowing for the provider organization to get paid, reimbursed by Medicaid, so they can pay Joe, the staff person, to care for the individual out of Joe's home. If that situation needs to happen, then the provider needs to designate Joe's home as a supported family caregiver setting, and we would need to update the CCB to add that service, convert the RHS to the SFC, and also go through the information on this slide in terms of the documentation, what needs to happen, and those sorts of things. As you can see later on in the bulletin, or the bullets on this slide, this is not a long-term solution. This really is supposed to be just for a few days or weeks, maybe up to 2 months. This is absolutely not the state's solution. And as I've already mentioned, it's absolutely the last resort. The state does not want to have to do this because there are some guidelines in place in terms of how structured family caregiver settings are set up that provide a lot of oversight to make sure that there's less of a chance of abuse, neglect, and exploitation and those sorts of things. And there are very strict rules about it. And so in this current time, a lot of those rules are being lifted just to have this opportunity available should the need arise. Today, most likely you should not be receiving a flood of emails from providers going, hey, Joe's gonna start bringing Billy home and they're gonna have this SFC set up. You should not see a flood of those emails today. That's not to say that in 2 weeks or 3 weeks or however long this situation exists, this option might very well come into play. So I'm laying this out here so you know what the expectations are, but hopefully we actually don't have to implement these. All right, telehealth. I'm just going to caution you. The bullets that you see on the screen here are the top set of bullets are the only waiver services that have been broadly approved for telehealth. These were specifically outlined in the bulletin that BEADS released yesterday. And they make sense that they could be provided in a telehealth component, but I also know there have been questions coming from providers about, oh, can we do PAC over the phone with these individuals or whatever. I'm going to talk a little bit later about answering questions like that, but for your information, these services are really the only ones that when you're getting those emails from the behaviorist or whoever saying, hey, we've implemented this Zoom session and we're going to do these now like this, for the foreseeable future until we get past this health crisis, that makes sense because that type of service is one of the broadly approved ones. There is a statement in the same bulletin directly below those bullet points that is exactly what I put on the second main bullet point here. There's a paragraph that talks about, however, for all other HCBCS services, telehealth should be a last resort option. And because of the way that's worded, it's implied that telehealth could be used. And so the 3 bullet points that are below there are kind of the guiding facts about whether or not PAC could be provided over the phone. So if a person is wanting, or a provider is wanting to provide PAC to an individual, if the person needs more than just verbal prompting and guidance, then it doesn't make sense that the PAC provider should be asking to do telehealth. And so in situations where somebody is saying, hey, can we just do PAC over the phone, use those bullet points as kind of a radar, I guess, in terms of whether or not you need to kind of question, you know, how does what you're proposing meet those 3 guidelines that the state established. And so again, it's not your job necessarily to say, no, you can't do that. They, as a provider, have to have documentation to support what they're billing. So if that's what their plan is, you can document, here's what their plan is. They're planning to do PAC. Case manager raised the question about, you know, how they were going to be able to do that since this person needs more than just verbal prompting or whatever. But provider continues to plan to implement this plan. You just need to document that sort of concern that you raised in their continued efforts to implement their plan in your case notes. You need to show that you kind of questioned it. Again, we need to make sure we're doing that respectfully, but we also aren't the ones that are going to throw up the red flag and forbid them from doing it. I have the big star off to the right that, again, just reminding, we're not arguing with providers. You know, it's certainly fine to bring up questions or clarification about what their plan is, but we need to do that in a respectful manner. And remember that their burden of proof falls on them for their documentation when they're in a billing audit. Their documentation has to support what the state says is acceptable for billing for that service in a telehealth manner. Okay, questions from providers. I'm just going to ask you guys, you know, if there's a question that they are asking you that is not person specific, like if they aren't asking you a question about, hey, is it okay if we just drive by over to Joanne's and pick up the mask kit and bring that back to the house? Will that be okay to work on for the goal in her PCISP for her craft class? That's a person specific question where it's okay for you to say, yeah, that seems like a reasonable solution. Thanks for bringing that up. That's a great idea. If they're asking you questions like, is it okay for us to bill PAC over the phone? That is not a question for case managers to be answering. You have absolutely no authority to tell them it's okay to do that. And I really want to caution you about answering those kinds of questions because it's probably going to come back to bite you. If they take whatever your response is back to their organization and say, oh, well, whatever, Kara Kimes said it was okay to do this. That's going to come back to Kara saying, how did you have the authority to authorize them to bill for this? We don't want to put you guys in a really awkward and potentially legal situation because you thought you were doing the best thing in terms of, you know, giving them a guess about what your answers are based on your understanding of bulletins. Please don't even put yourself there. If they're asking you questions that are not person specific, the really best answer is to direct them back to DDRS and BDDs because those agencies within the state are the ones with the official answers. They're the ones with the authority to say, yes, it's okay to provide services out of that location, or it's okay to do telehealth in the way that you're proposing, or whatever the question happens to be. It's also okay to refer them back to the BDDs bulletins. The providers have the same access to the bulletins and the provider guidance that's been released to everyone else who has been signed up for those notifications. They can read the information just the same way that you can, and it's not your job to interpret what the guidance from BDDs says. If they have questions about what BDDs has said in their provider guidance, they absolutely need to go back to BDDs for their own clarifications. Okay, so I have a feeling there are several questions that have come in. So I've kind of been ignoring the chat box and the questions until the end. I very much want to answer everyone's questions, but I want to acknowledge that there are some people that may not have the ability to hang on the call. Every single question that has come into the questions box and then will be answered. Please check back in on that state of emergency thread on the Teams app, you're welcome to hang out on the call because I am going to answer them verbally on the call, but I understand there are some people that actually have some other things going on and maybe weren't prepared to stay beyond an hour today. So I appreciate those that were able to stay, and I will be answering the questions verbally, so it's part of the recording. But if you need to leave, be assured that the recording will be posted and the answers to the questions will be posted in that thread. Okay, so give me a minute to pull up the questions here. Okay, let me get rid of the ones that we kind of already answered. Can we do an environmental inspection via video chat if there is an individual and staff already living in the home and my individual is wanting to move into the home with that individual? That's a really good question because typically those environmental inspections are done in person. At this juncture, I would say that it's probably safe if you've got the component on your phone and somebody in the apartment has the ability on their phone to do like FaceTime or video chat or whatever the term is for the phone that you are using. I would say go ahead and move forward with that approach, but just be very, very clear in your case notes when you're documenting what has occurred that this activity occurred via video conference or whatever the application is that you're using, so that it's clear that this was not something that you physically were standing in the apartment. The other thing about when you're entering the case note, at the top of the case note where it's asking kind of the level of participation, I don't have that screen open in front of me right now, but you all are familiar with it, I'm sure, in terms of, you know, whether this was a face-to-face or whether this was a phone call or those kinds of things. I believe there's now the setting for the virtual option in that drop-down list. And so in my head, the difference between virtual versus phone call is that virtual is kind of that video component, whereas phone call is solely just voice exchange. So as you guys are doing your case notes, please apply that kind of principle in terms of which one do I choose. If you've done that face-to-face kind of video chat or FaceTime or whatever it's called, then please make sure that you're choosing that correct option, and then in the narrative of your case notes, you're being clear about, you know, whatever the app was that you were using. Hang on a second, I'm trying to answer some quick side chat things. Okay, so there's some supportive comments that I'm reading to myself and not really out loud. They aren't real questions. Some comments about masks and things related to what I shared about the Joanne Fabrics giving away things. Yes, I'm aware of those. Okay, so here's a question. So if the child has been e-learning at this time, do we also case note this as well? Sure. You will see in the case note examples that I'm going to be sending out immediately after this call, there's reference to the e-learning. So you might want to take a look at that as a way to kind of look at how you might word that in the context of the note and even the conversation that you might be having with the family. Yeah, I don't think it's safe to assume everyone is e-learning, because I believe there are some school systems that don't have that option. So yeah, it's definitely not okay to presume that everybody has those. Okay, what if we have had over 20 meetings during 16th through the 20th and did not go through some of these? I was just trying to navigate and play down panic to my teams. I assume you're referring to the suggested template of questions to kind of follow as you're having conversations with people. If you didn't gather that information in the conversation that you had with them, it's fine, because you didn't have that information. So it's not that you've done something wrong or bad. The suggestions I'm giving you today with that template is more kind of moving forward. Here's some things to think through as you're talking with people. In terms of the questions about, are they healthy now? Are they, what's the plan if they're, might need to move, or those kinds of things. Maybe when you follow up with the people, like if you just had the meeting on the 17th or whatever, you're most likely not going to wait until 3 months from now to reach out to them again. So when you call them in a week or so, or whatever makes sense for that particular situation, those would definitely be questions that I would bring up during that conversation and document it at that time. Sorry, I'm trying to write answers, since I guess I'm the only one writing answers today. And the answers that I'm writing right now for the person that is copying the information into the Teams app, I will come back and add some additional information to the answer areas after the call. I'm just trying to hurry through the questions and be respectful of people's time. Okay, so the next question, I had a provider email this morning and asked for day services to be transferred to them as the day program closed. That was all that was stated. Went to multiple case managers, so I understand they can do day services in the RHS home. Yes, it's true. They can do day services out of the home, and what they're calling day services may not really be what the person might have been doing in the day service location. So for example, if a person was working in a workshop kind of environment where they were packaging parts in bags and sealing the bags and doing those kinds of things with the machines on the floor and those kinds of things, that type of activity is probably not something they're doing in the person's home. But in terms of providing some sort of service during daytime hours, a lot of people call that day services, but it's not exactly what they were doing before. So one of the things providers are still kind of figuring out, as they've received yesterday this guidance from the state, is what do they need to bill in terms of this staff support that they are getting during daytime hours. It doesn't make sense for them to bill pre-voc because they're not doing pre-voc. It might make sense for them to bill RHS instead, but providers are still figuring out what service they actually need to be asking for if we need to update CCB. So it's fine for them to send you the email to say, here's what we're doing. We shut down the day program. We're going to be operating out of the homes. We're shifting our staff who used to work on the workshop floor. We're asking them to go to the people's homes where there's the greatest support staffing needs. And they're doing something during the day, which again, probably is not the bagging the parts in the plastic bags. So in your case note for that situation, you need to share what the provider's plan is, and then you'll want to follow up with the provider a little bit later in terms of what sorts of changes we need to write to the budget to reflect what they're actually delivering. And don't rush them with that. I anticipate the state is going to provide some additional guidance on timeframes, allowing for that. As you're aware, we can't do retroactive plans, but I have a yeah, they're going to allow retroactive plans as a result of this, because we can't expect providers to have that all sorted out. So just be patient with them. You know, if you haven't heard from them in a month or so about what their plan is, then you might want to just reach out to them. But right now, things are happening fast and furious, and they're more concerned about communicating with case managers about, you know, what's going on in terms of where people are and are they safe and healthy. For those that like to critique spelling errors and grammar errors, I'm just going to warn you now. If you're reading the comments that are originally posted on the thread about my answers, it's flooded with typos. I'm not taking the time to proofread, so don't be too critical, please. What if the team is not aware of the sleep staff and then comes into play during this time? Do we have not ask if they are doing this at this point and then have phone conversation to have discussion after the fact? Okay, if I'm understanding this correctly, I think you're asking what happens if the staff person that's working the overnight happens to fall asleep? What do we do with that information? If that's the situation, one, I don't know how you're figuring out that they're sleeping on the overnight because you're not there in person if you're doing your stay-at-home order, but maybe your consumer called you and said, hey, I woke up in the middle of the night and found my staff asleep on the couch. It doesn't really matter. Right now, if you become aware that somebody has fallen asleep on shift or whatever, yes, we need to be reaching out to the provider to say, hey, I heard about this. Are you aware of what's going on? Do you need to immediately write an incident report about what's going on? I would weigh that. You can write an incident report about that and then wait for the investigation to happen and those sorts of things. But in this time of are people healthy and safe, you know, if your individuals are in a situation where it's absolutely critical that there is not any sleeping going on, then perhaps that's a situation whereby you do need to submit an incident report. If it's possible that somebody could get through the night without having 15 minutes of a nap from the staff person or whatever it was, we don't know how long they've been sleeping. I'm just saying we need to be a little bit compromising, bearing in mind that was there a really serious health and safety risk for somebody actually sleeping? Yes, you'll want to clarify, you know, has the organization implemented the sleep staff component? Maybe they did and they just forgot to tell you that and you just need to clarify that with them. Yes, the key piece in this question, I think, is just opening up that line of communication to say, just help me understand what's going on and then document that in your case notes. I just want to be clear how we are to handle the monitoring signature page during the conference calls. Do we send the page for everyone to sign? who participated by phone, or something else? Great question. We actually have somebody that is researching currently some options we might consider as a company in terms of looking at methods of electronic signatures. Currently, what I have instructed all of our staff to do in a previous correspondence is the case manager needs to be writing on the signature page in terms of whoever participated in the call on the line for the individual. If the individual was present on the call, on their signature line, you just need to write their name as you normally do in terms of printing their name so it's legible. But on their signature line, where they actually make their mark or write their name in person or whatever, on that line is where you need to print legibly participated by phone or FaceTime or video conference or Zoom session or whatever method it was that you conducted this meeting or visit or whatever it was. You just need to be writing that, and then you're scanning in and uploading that signature page. It doesn't truly have signatures other than yours, but you've designated on the signature page who participated in the call by marking their names, but also marking that they participated in whatever function they participated. So that's how I've suggested the easiest way to handle that signature page obligation right now. There are some people that are able to email the actual signature page to all of the team members, and they're like digitally signing it and scanning it back in, those kinds of things. Those are kind of convoluted, and there's a lot of follow-up to make sure we've got everybody's signatures and those kinds of things. You're certainly welcome to do those if that's something that you've become proficient in, but right this second, there's not been any mandates from the state about how they expect to see the electronic signatures. So at the given time, crud. At the given time, the expectation is at the bare minimum, you're just writing in their phone participation and uploading that report to the document library. Okay, I need to pause just for a second. The person that is supposedly uploading all the questions and answers to the Teams thread is not seeing all of my responses. Give me a second to resolve this. Are any of the admin staff who are on the call currently working on their computer? If you could unmute yourself, one, and just tell me.
I am.
Heather's on the computer.
I'm on the computer.
Amy is too.
Me too.
Okay. Amy, I don't want you to do it because I got you doing other things. What I need you to do is look at the chat box, and not the chat box, the questions and answers box, and either do screenshots or in some way copy and paste all the questions and answers so that we can get those moved over to the Teams app. I have incorrectly been hitting the answers to the questions as a private response to whoever submitted the question instead of sending to all. So it's prevented the person that was doing that from doing it the way that we originally planned. So moving forward, I'll hit the send to all, but I was doing it wrong before. So
I'm not sure because I'm on as a panelist, not an organizer. And in the chat box, I literally only see the conversation. I'm not seeing the questions and answers, and I don't have a question and answer box. So I don't know since.
Yeah, I didn't want you to do it anyway.
Okay, just letting you know that I don't know that if other admin staff aren't on as an organizer, if they can even see all the questions and answers.
I can't see the questions and answers, only the responses. The last question I see has to do with documenting case notes for e-learning.
Yeah. Okay, I'll have to figure that out later. I know there's a way to pull a report after the call ends to show me all the questions and answers when the call ends. So that's the way I'll have to do it. It's fine. Moving
Hey,
forward.
Joy,
What?
I can do that for you because I've got to get this all converted, the recording converted. So I
Okay.
can pull that for you. It takes just a couple minutes.
Yeah.
It's quick.
Okay.
I'll send that to you.
Thank you. All right. Moving forward, the person that's helping me with the Teams thing, I'm going to make sure I'm hitting the send the answers to all. So you should see those popping up. So the questions from now forward, you should be able to see those. Oh, technical difficulties. See, it's not just you guys that such struggle sometimes. I screw up too. Send to all. Sorry, you may hear me say that. It's my own visual cue and verbal reminder. Okay, so next question is also, are we supposed to hold transitions we had in process? If not, do we do pre-post checks in person or virtually? Great question. Okay, so what's the answer, Joy? You need to reach out to BDDs to ask them how they want you to proceed with the current transitions. They are kind of the deciding factor on where things fall. If you've got somebody that all they have to do is sign off on the 7-day checklist or whatever, then BDDs will likely say, yes, go ahead and do that virtually, record that in your case notes and sign off and upload the documents like you normally do. If somebody has just told you, I don't like who I live with, I want to explore, what other options I have, I have a buddy that lives across town, can I go move in with him? That's a situation where typically we would start the transition process and kind of get the ball rolling. In that situation, BDDs will likely say, can you please try to work things out with the guy and his current roommate, just so we can get through this healthcare issue right now, and we'll definitely revisit this conversation. Those may be completely different answers that the BDDs worker would give you in terms of, should I continue with the transition I currently have in process? Again, there's, several individuals that we have that, are in the transition process, but they don't have a housemate identified. They don't have an apartment lined up. There's like no movement. There's no activity occurring. And so those may be situations where BDDs might just say, you know what, let's put a pause on the transitions and for this specific situation, and let's revisit this in 2 months or whatever. So the first step really is to contact BDDs to ask what their guidance is on that specific transition. And again, whatever they tell you, please make sure you're documenting that in your case notes so it's clear for whoever's following this case to figure out, well, wait a minute, 3 months ago there was this discussion about transitions. Why has there been nothing said about this? If you're not writing in your case notes that you talked to BDDs and BDDs said put a pause on it, then there's no clear evidence of why there's no current conversation about this transition. So please just make sure you're putting in your case notes whatever the direction is. Send to all. Sorry, I'm laughing at myself. I have a few case managers who have consumers who are in the midst of transitions, and some of these may not be able to wait for various reasons. How should case managers handle inspections during this time? Okay, I feel like perhaps we've already answered this, but again, please communicate with BEADS to make sure BEADS is wanting you to move forward with that specific transition, because their decision might differ depending on where they're at in the transition process. In terms of the actual inspections, I think, again, we've talked about if the case manager and someone in the apartment that they're planning to move to has the capability of doing that FaceTime component, or whatever the term is for what phone system you're using or whatever. If there's that ability to do the video kind of thing, then we've talked about making very clear in your case notes that, you know, you had the staff person walk around the apartment and show you that, you know, the water's, you know, the right temperature, and whatever those kinds of, all those questions on the checklist are. As long as that's happening, just be very clear in your case notes. Exactly how that activity occurred, because again, typically those inspections do happen in person, and since we're altering from that norm, we need to be very clear in our case notes that we've changed that in this particular situation. We don't want to omit that information, because since it is the norm to do it in person, if Medicaid comes along and audits our records, if we've not reflected that it happened virtually versus in person, they're going to assume it happened in person, and we'll be in a situation where they're saying, wait a minute, we just discovered you didn't actually do that in person. You know, you need to pay back this money because you falsified this information. So please, again, I can't stress enough about just being clear in your documentation about exactly what's happening. Encourage anyone that is processing intakes to go ahead and do intake meetings virtually to try to get enough information to do an initial PCISP. Don't put meetings out a month in the hope that you can meet in person. The last intake call was one day before we were told to do 100% of meetings by virtual means. I had said on the call that in-person meetings were still ideal. And I'm going to scroll down. We really need to go ahead and do the meeting virtually to keep progress going. We may get slammed with intakes once the shelter in place is lifted. Want to get as much done as possible on current intakes to keep case managers and transition managers from drowning when that happens. Yes, thank you for that reminder. I actually did put something on the slides related to this, but I somehow skimmed over that, so I apologize. I don't know that I need to reread everything that was suggested, but that is definitely something we want to encourage people to move forward with, those virtual means of communicating to getting those intake meetings happening. And again, as was mentioned, it's not ideal. It's not our preferred way of doing things, but for the next whatever, couple of weeks, months, whatever, it's the way that it needs to happen to keep the ball rolling. Send to all. Please explain how we should proceed on needing documents signed. I think I already answered that, but maybe not. I answered the part about the signature pages for meetings. Perhaps your question is referring to like the handbook signature page, or PCISP signature pages, or those sorts of things. So again, those would be situations where we don't want to completely ignore the fact that something needs signed. We also recognize that we can't physically print off a piece of paper and drive it over to somebody's house to review with them and have them sign it in person in today's current environment. So for the time being, if you've held your annual meeting and you need to get them to sign their PCISP document, they need to sign the DDRS manual signature page, they need to, whatever all the documents are. Sorry, I can't think of them right this second. I know there's fewer now, but I know that there still are some. In those situations, I guess my suggestion is, until we find out a better solution in terms of potentially using electronic signatures, which I understand is not the solution for everyone, because not everybody has that capability in terms of the families that we support and so forth. For the time being, I would probably enter a case note related to, you've got the signature pages compiled, and we'll meet with the individual at the earliest opportunity, once the health situation resolves. And so maybe that's, the next team meeting that's coming in a quarter, maybe that's in 6 months. We don't really know what it is. So just please document in your case notes that you recognize that you've got these documents that need to be signed. Yes, there may be a situation where we get a CRR saying, oh my gosh, you don't have your signature page within 30 days of the meeting. It's a hit we're going to take. And I know nobody likes to see those pop up, but rest assured, nobody's job's in jeopardy because you weren't able to physically go out and get somebody to sign a piece of paper. That's not the high priority factor right now. So please just document in your case notes what's going on related to that. Maybe consider adding that as one of the tasks in that case note area, where you're saying, hey, here's some things that the case manager still needs to do. Maybe having that marked as something in that task area will be an indicator to whoever is reviewing, whether it's the CRR people or whatever. Maybe seeing that in that task area will be kind of their, oh yeah, the case manager knows they still need to do it. It's not that they've forgotten it. It's just that because of this health crisis, it's going to get done in a little while. I have a 30-day post-transition due April 6th. I am assuming I should wait on that. I have 14 case notes for the month of March, and there has been a lot of other things done for this consumer. I know he is all good. This would be a situation where I would encourage you to reach out to BDDs to ask for their guidance on how they want you to handle that situation. My hunch is they will say, just do that post-transition by phone call or virtually, or however they guide you to do that, and then document that in your case notes. But please reach out to BDDs first for them to tell you how to handle the situation, and then document that in your case notes and proceed as they've given you guidance. Send to all. What is the recommended way to get signatures after each virtual meeting? Will Advocacy Links be getting hello sign or something similar? Sending out a PDF to each person results in multiple copies of one document. Some guardians are not even able to sign on the computer when have to print, hang on, scrolling down, and mail, which is a huge hassle. I think we already answered this one. We had encouraged people to, for the meeting signature pages, just write in on the signature line, the person's, well, on the name line, print their name, but then on the signature part of that page, just indicate how they participated, whether it was by phone or Zoom session or whatever. We are looking at some options for electronic signatures, but again, we also recognize that's not going to solve all of our problems. And so we may or may not decide to move forward with setting up some sort of electronic signature option. But for the time being, let's just the case manager handwrite on the signature page however the people participated. Make sure you're listing all the people that participated, but then just designate off on the actual signature line that they participated by phone or Zoom or FaceTime or whatever method it was. Send all. Through the intake process, should I be talking with parents about being staff for their minor children? Oh, that's a really great question. I guess I would suggest weighing the situation. What I want to avoid is setting families up for unrealistic expectations. If they haven't already been receiving services, I can see how they might go, oh, you mean I can get paid to take care of my 4-year-old? I can see how they can see that in the here and now as something being an option, and then whatever, 6 months down the road when the provider says, oh yeah, you can't do that any longer, they'll throw their arms up and be highly frustrated and angry because they will have maybe thought that they're being misled about what services are available. So I guess I would be super cautious about explaining that as an option. It is true that it is an option for the here and now, but I would be super cautious about presenting it as a viable option for this particular season of time, because we know full well that's going to go away. When, we don't know. It might be 2 months, it might be 2 years. We have no idea. So I guess I would just caution you about suggesting that as the first option. So we have to identify what app we are using when completing video conference. Then I would suggest that you do. The reason I'm asking you to do that is there's very specific guidelines that the state set up in terms of making sure that there's a secure private connection for conducting these virtual phone meeting. They were very clear in there about, they specifically mentioned FaceTime as an option. I don't remember if there were some other options that they specifically mentioned. I was drawn to FaceTime because I have that on my phone, and so it made sense to me. I know there's hundreds of other things. Please just kind of put that in your notes as part of what you're including, so that it's clear that whatever you're using is something that's a legitimate, private, secure option. I have an annual assessment today. Should I mail the Form A signature page to the parent and sign and return to me in a self-addressed stamped envelope? Sure, that seems like a reasonable solution. Please also remember, if you're using these self-addressed stamped envelopes as an option, envelopes can be obtained through the Staples account, and postage is a business expense. And so if you are needing to itemize those out on your expense reports, please don't forget that those are things that we can be reimbursing you for. Well, the Staples account is not a reimbursement thing, it's just something you order, but the stamps, just a little reminder that that's something that you're not having to pay out of pocket. Is there still a webinar next Friday since we had a webinar today? Yes, I believe we have a guest speaker already lined up, so we don't want to shortchange that opportunity.
Oh, they're all gone. Okay.
Somebody has unmuted themselves again. Somebody made a comment about a lot of providers are billing FHG out of the home. That may very well be true, but it's most likely not true for all providers. So again, my advice is still speak with your individual providers about what their specific plan is. Would you please email the quiz link as well? Sure, yes, I can definitely put that in the body of the email. Plus the slide presentation also has that link in it as well. I am only able to see one question. Yeah, we got that resolved. Sorry about the technology difficulties, guys. Again, I'm not perfect either, so. Sorry, several responses related to the technology difficulties. Somebody asked if Hangouts, the app, I guess it's an app, is a private connection to do those virtual or phone meetings. I honestly don't know the answer to that question. One of the bulletins that I shared very early on from the Office of Civil Rights had some information specifically outlined in there, and I think that might be where I read some of the specific types of technological applications that could be considered, and certainly that probably was not a complete list, because as you're aware, there's gobs of different options that are out there. But part of that bulletin also said that in this time of everyone doing the best that they can, the connections in terms of making 100% certain that it's a private connection or those kinds of things, some of those concerns were going to be lifted a little bit, or some leniency was going to be granted, because the Office of Civil Rights recognizes that everyone is doing absolutely the best that they can to maintain privacy, but there may actually be, somebody accidentally used something unintentionally to try to maintain lines of communication, but at the same time, they might have chosen an app that may not have been 100% secure. So my advice is, whatever program that you're choosing to use because you're familiar with it, or you have an understanding of how it operates and you're very comfortable with it, please continue to use whatever you're comfortable with. If you come to the understanding that perhaps it's not the most secure, or that people are jumping in on your call when they shouldn't be, or those sorts of things, then you might want to look at something else just to maybe beef up that security a little bit. But I don't want people to spend hours and hours researching and looking into other options because they're maybe not certain about something. So please just continue to use whatever you're using, and just know that in this time, we recognize everybody's doing the best that they can, and we're just going to have to live with it. I have an individual whose guardian decided now was the perfect time to take advantage of low airfare, and so they went to Florida. I talked with them yesterday and they are due back tomorrow. Guardian mentioned they have been sightseeing, swimming, going to the beach prior to it closing, etc. Should I recommend he stay with her at her house for 14 days instead of returning to the house with a housemate? I worry, hang on, I gotta scroll down. I worry about the housemate being at risk, or do I leave this up to the provider? I would leave it up to the provider. The provider is the one that's providing the staff to this person. They most likely have visitor guidance that they're implementing in their locations and those sorts of things. And so I feel like the provider is the one to call the shot on this one. It's probably not harmful to suggest that to the guardian, but you can present it in such a way that, you know, something they might want to consider is perhaps the provider might have some requirements for his return to the location, and whatever they have established as their protocol is what the team needs to follow. No matter what you say or do is going to change what the provider's protocol is. And so I kind of want to try to avoid setting you up for a potentially volatile situation, you know, in terms of a fight between the guardian and the provider agency. So I guess just kind of maybe leave it up to the provider to introduce the idea if you feel like that's appropriate. Okay, at the moment, the question and answer box is clear, but I know there were some things put in the chat box, so let me go through this. There's a comment related to a reminder for the beamers. We cannot submit a beamer if somebody is on a daily rate. We have to submit the JIRA ticket to request that people get off of the daily rate before we submit a beamer. Hang on, let me read the rest of the comment. Okay, so the question within that was there are some providers that are asking for that JIRA ticket to be submitted so that the daily rate can get switched over to the hourly rate, so then they can submit the beamer request. I get it that we're getting those requests. Until yesterday, there wasn't any guidance from the state about how they were going to handle those situations. My hunch is there will be some additional guidance coming along in this specific area. And my hunch is they're going to do retroactive conversions for the daily to hourly to include the month of March. All of the information within the bulletin keeps referring back to all of these changes will be retroactive to March 1st. And there's conversation in there about the ability to submit the beamers, you know, beyond the first one and for 90 day, or I'm sorry, for 60-day periods and so forth. So my hunch is that they're going to update the technology to enable us to do that. It's just not there yet. So please just be patient with allowing the state to get the technology to catch up with the decisions that they're making in terms of how to handle the situations. Somebody had mentioned about it's encouraging to see some of the relaxed standards, but they're very nervous about some of the relaxed hiring and training standards. I don't disagree at all. There's a lot of things that came out in the relaxed standards that just make me cringe. But we all just have to recognize everybody's trying to do the best that they possibly can. Are bad things going to happen during this time? I'd like to say no, but the reality is there may be some very unfortunate events that occur, and no matter what we do to try to prevent that, I'd like to think that in most situations the relaxed standards are going to be okay, but there may very well be situations that we are not pleased about at the end of all of this. Okay. Okay, Amy mentioned that she did go ahead and send out the link to everybody for the quiz in an email. I will be sending out the example that I referred to about the case notes and kind of the reminder about the template and those kinds of things. I'll send that out here in just a couple of minutes. Are there any other additional questions that people have that they want to try to sneak in here at the last minute? If you're in the middle of writing a really long question, it's okay to just hit the post question and then finish typing. That way I will know that you're trying to submit something and I won't cut us all short. All right, it looks like it's straight up noon and we went for a little bit, okay, an hour longer than I planned, but I knew that there would be some questions. Again, I just want to reinforce the fact that that Teams thread really is the go-to place to get as up to the minute as possible information. I want to be very cautious about having case managers rely too heavily on going to their supervisor with questions related to the COVID situation. Not that your supervisor doesn't know what's going on, but they may have a little bit of backlog in their email. And if they're still kind of operating on something they read 3 days ago and trying to answer your question that just came in, they again are doing the best they can, but they're actually giving you wrong information. Because if I just sent an email out 5 minutes ago, or I'm currently on a call where the rules are changing, there's the best place to really go to get absolutely current information is really that thread. If some of you are unsure about where to go to get the Teams app or how to make that work or those kinds of things, please talk with your supervisor about those sorts of things so they can get you headed in the right direction. If the supervisor themselves is maybe a little apprehensive about using that type of software, it's completely fine to reach out to a coworker. Josh can help support you in that. Reach out to me. I'd be happy to help you get that set up. We're all in this together, and so we all need to be making sure that we're supporting one another in the best way possible. There was a couple more comments here. Let me make sure I grab these. Okay, it looks like all the questions that were actual questions that needed answered have been answered. I again appreciate all of you guys so much for hanging out for time that you had not planned for today. I hope this has been helpful and clarifying and consolidating hordes of emails that I'm sure you've received over the last week or two. It really was my intent to try to simplify things and have a more consolidated view so you can hit the ground running, because I know your job has changed dramatically. Even if it's just temporary changes, I get it, that there's so much else going on in your lives that, you know, sure, you're at home all the time, but that's not necessarily a good thing. It doesn't mean that you're, you know, able to sit in front of your computer for 12 hours a day or whatever to type in case notes or whatever. I get that. I know there's other things going on. So all we're asking is just communicate, document your case notes, those sorts of things. Reach out if you need help. There are other people that can step in and help if we need to. So, all right. Thank you again all for your time today. I appreciate you and all the work you guys are doing in this constantly changing environment of our jobs. Have a good rest of the day.